It's interesting because when we talk to our clients, many of whom have dealt with grief, they sort of brush that aside. They talk more about their clinical depression, they talk more about their clinical anxiety. But when we ask them about things that could have potentially been traumatizing to them, they don't really think of grief as something that they say. And yet, complicated grief can be a sort of trauma. And if not dealt with, it can absolutely be risk factors for clinical depression and anxiety and other conditions as well. And I think in some ways people don't think of grief as trauma because all of us have to deal with it at one point. We're all gonna have a loved one die at some point. And maybe it just feels like we're all supposed to suck it up and just move on with our lives. But sometimes that grief can just prolong for years and years and have these effects on our physical and mental health. And recently there's been some research about the fact that after somebody dies that was very important to you, that you can start to develop a lot of existential anxiety. And sometimes people don't trace that back to the grief, but it makes complete sense that when somebody who you love dies, it forces you into a place in your life that you start to reflect on your own existence and your own demise and possibly other loved ones dying and what that's going to be like. And so I think complicated grief is important to deal with, and we really try to talk about that. We have treatment groups that deal with grief specifically, and we normalize the experience for everybody that people struggle and sometimes maybe even struggle for years after a loved one dies. But we also let them know that it is an important thing to deal with, that even if everybody deals with it, it can still be a clinical problem and we need to address it. And I think grief can also come in many forms. Aside from death, there could be just the loss of a relationship, the loss of a career, the loss of an identity. All of those things also carry grief elements with them. And so when you see an individual who perhaps has moved into a different stage in their life, for example, retirement, they lose a sense of purpose, they lose a sense of self, and even that in itself can contribute to complicated grief. So I really think that almost every single client that we see at Bridges has some aspect of complicated grief that they're dealing with.